So we just published an interview with Chris Klomp, who is now the number 2 at HHS. When we interviewed him, he was running Medicare, which is still a very big job. Medicare covers about 60 million Americans' healthcare right now, of course, available to people over the age of 65. So I wanted to reel off a couple of things that I think were really important from this interview with Chris. And then, of course, we'll be dropping a link to the full thing in the comments. So the first thing he said that was really important was this language of insurgents versus incumbents. To hear somebody from the federal government clearly want to create a kind of healthcare system where incumbents don't always win, I think that is something new. I haven't heard it before as somebody who's been in the space for 15 years. It is so hard to be a healthcare entrepreneur. So to have somebody who's got an entrepreneurial background themselves and is really thinking about this in such an important role, I think is really interesting. The second thing that he said that really stood out was related to the idea of how you incorporate AI into healthcare and what's the right way to do it. Is it through the traditional system, like adding it to the fee schedule? Or is it some other methodology? And we talked a lot about the access model, which CMMI, that's the innovation part of CMS, just rolled out. And that's the idea of outcomes-based pricing. So that's definitely on the roadmap. Lots of discussion about the right kind of pricing. How do you make it low enough that healthcare becomes deflationary, while still having it be high enough that it becomes worthwhile for startups in the space? So I thought that was really interesting, the shift to outcomes, thinking around AI. I think the third thing was really around the hiring that CMS is trying to do right now. He made it very explicitly clear while speaking with us that they need people across all facets, across all levels who want to come in and do a tour of duty. Could be for 3 years, could be for a few days. It seems like the need right now is dire. So if that's you, I think this is a moment to raise a hand. What we didn't get into is obviously some of the more controversial aspects of HHS right now, whether it be in vaccines, whether it be in Medicaid cuts. The time that we spoke with him, he was running Medicare, but I could definitely see us speaking with him again in the future. I think there's so many important topics right now in healthcare. So there's your little overview. I hope you enjoy the interview and you can read the rest in the comments.